Welcome to the One Day at a Time Recovery Podcast, where my guests share their stories of addiction, how they recovered, and the tools and practices they use to stay sober now. Well, Dr. Rodriguez, thank you so much for joining me today.
Thank you for having me.
Yes, of course. I'm really excited. Listen, there's not a lot of opportunities that I get to speak to my people. I'm half Mexican. I know you're Cuban. Habla un poquito español, pero
Español.
no mucho. So we're going to keep it in English. But I think it's so important for people to know that there are people out there like you who are bilingual. So I just want to throw that out there right in the beginning. Do you feel like our Hispanic friends are underserved?
I mean, yeah, there is some aspect of not having enough resources, but
Yeah.
when I'm talking about not having enough resources, I think there are a lot of providers out there and people that work with patients in this arena where they are culturally conscious.
Hmm.
But I've noticed with Hispanic patients, they want more than just culturally conscious. They literally want them to be able to speak their language because they just can't express themselves better
Yeah.
in another language. And I get it.
It's not
But
the same.
it's not the same. So I
Yeah.
would say I think there's more resources, but then when it comes to that, which I noticed that that's what they look for,
Yeah.
we're still kind of a little bit behind.
Well, listen,
Because their
that
lingo.
makes a good case for having you on the
Mhm.
podcast and making you available to people
Yeah,
are
anytime.
who speak Spanish. But we're
Mhm.
going to talk about your area of expertise is pretty broad, but we're going to kind of narrow it into trauma-informed care. We're going to talk about the difference between peer support and professional support. And recently, I've sort of been on this kick. I'm doing like a little mini episode series about sobriety reset. When somebody relapses, what is a good starting place for getting sober? Do you have like specific recommendations for people that are like, okay, I'm gonna start this path of sobriety? What do they do in their first 30 days?
A lot of people that I work with don't want to go to rehab. They feel that it's too quickly to say in 30 days, we're going to fix a lot of issues. So
Yeah,
to
yeah,
say
for
to
sure.
someone that, oh yeah, here, go to 30 days to this place and you'll come out all good.
I really hope nobody is saying that.
I
That
really
is
hope
just
that's not happening. But
it's utter
unfortunately, I think
insanity.
our medical system is not yet at a place where we need to really restructure how we help
Yeah,
people who are struggling with a substance. And let's
yeah.
look at it again, right? Because obviously there's physiological things that happen in the first couple of days. For some other substances, it could
Detox.
be in 6 weeks, you know. And I'm sure we'll talk about cannabis, but cannabis is one that can take a long time to start feeling any withdrawal symptoms after you stop. So 30 days, it's too cookie cutter. So to answer your question, I would say you got to work with a good team of people that understand how to help someone in sobriety. Is you have to really shop around for therapists, for counselors, coaches, people that have that mindset to like, okay, we're going to do this together. We're going to go down this dark alley of the first even year, I would say, of ups and downs. And I'm going to be here with you and I'm not going to judge you. So
Yeah.
no judging is priority.
Yeah, compassionate support.
Mm-hmm, mm-hmm.
Yeah, that's really
And
important.
real.
Yeah, yeah. The system is definitely broken, and you're right.
Mm-hmm.
30 days in a rehab is not enough time to like get all better. I do like the compassionate support. That's really important. What about in terms of physical practices, mindset shifts, things like that? What do you think is important to start adopting in that first 30 days?
For sure, things like mindfulness meditation is something that I teach my patients to do. I start focusing on who they are. Tell me, how will you describe yourself? If I would Google you, tell me what's on it. How would you describe yourself? I think that self image plays a huge role in recovery too. So it also gives me a good idea of where they're at. But I think to me, those are one of the big ones, journal writing, expressing themselves in a way that they've probably never expressed themselves before. So if there's some kind of art therapy, some kind of sport, something that they can start, putting it into motion, into action, that has nothing to do with this other behavior that was being done over here.
Yeah.
So that's why I always tell them, tell me how you would describe yourself. What are some of your interests? What are the things that you love to do? This doesn't define you. This is just something that you're doing because there's something
Mm,
underneath. But
yeah.
forget about that. We'll put that aside. Who are you?
Yeah,
I think
that's
people
a big
don't
question.
expect that,
Yeah.
you know. But
Yeah.
I give them that as an assignment. One of the first things I have them do: go home and bring it to me. Describe me who you are. I want to get to know you,
Yeah.
not just by how many times you've been hospitalized or how many times you've been to rehab or how many times you relapse or what substances you're using. Fine, we need that information, but let's focus on who you are because this doesn't define you.
No, that's beautiful. Let's talk a little bit about the difference between peer support and professional support. They sometimes they say the difference between professional support and peer support doesn't say your time is up. You know, you know.
Well,
Um,
honestly, sometimes I go overtime. No, like I think we need both of them.
yeah.
I think professional support we definitely need it because it's like having that rear view mirror. That professional is going to already see what could be coming down the corner that a peer might not. But the peer support is needed right away. And I always tell patients we got to find that one or two people that you can really count on who's going to call you out, who you trust that they're going to call you out.
Mhm.
So then if they start seeing like, hey, you're doing this again, you know, so you do need that because the professional, you're not going to be with them all the time, right? But the
Yeah.
professional is definitely going to keep an eye out for things that could be coming down our path, and you are not seeing it because we've done this so many times,
Yeah.
right?
I also feel like the one thing that is so important about professional support is there are some things that people in peer support programs or those support groups they're not actually qualified to handle. And I know you do a lot of work around trauma. What is it about trauma that causes people to, repetitively relapse?
Trauma, in my opinion, is what's underneath any substance or addictive behavior.
Yeah.
Um, every single person that uses this anything. I always want to know what you're using because that can tell me what your brain wants. Um, but when it comes back to the trauma, I have to treat the trauma. So it's the same thing with like putting the substances and the addictive things aside and say, what really happened? What are you trying to numb out? What is it about your life that you don't like? Or the thoughts that you're having all the time that you don't want to have? So you're doing this to not have them or to numb them out or to get to a place where you think that it's going away, but then when you sober up, those thoughts come back, those memories come back. So that hasn't been really been resolved, right?
Right.
So that's why I always say like underneath any person that's struggling with anything that is addictive, there is a trauma.
Yeah.
We just have to identify it. And if the person already has it identified, great, we have a great place to start. But most of the time, and I'll tell you this, is not just that one thing. Could have been a
Multiple things.
bunch of other stuff that happened along the way that added to that physical, sexual, or psychological abuse.
Yeah. You said
Unfortunately,
something interesting that I don't think any I've heard from anybody is that you're interested in what kind of substances that they're using. So that kind of makes me think, oh, if they're using speed drugs,
mm-hmm,
they're like speed drugs or slow down drugs, like
mm-hmm.
the downers and stuff. What do those two things tell you about the person that's in front of you?
They tell me usually what their brain is doing or not doing. So, for example, someone who's really into stimulants, right? Any kind of stimulating thing, right? It could even be a sexual addiction, which is very stimulating and exciting. It increases dopamine. So then that tells me that your prefrontal cortex is probably a little sleepy. It's probably a little bit turned off. And that's your way of getting it back online,
Mm,
you know? So the same thing happens with things like alcohol or cannabis. Those things tend to slow us down. They slow down the limbic system. So that means most likely that person's limbic brain is on fire, is overworked, is overactive. So they're trying to self-medicate with that substance, right? That is very GABAergic, I tell them. So to me, it tells me a lot of what their brain is doing. If not, I'll do a spec scan to see what their brain is doing, and then I can really
yeah.
prove to them. You see, this is why you're doing this. Now
Interesting.
let's work on improving it. Most of patients with that prefrontal cortex turned off, I noticed that usually it's a small brain injury. They could have had a brain injury when they were a little kid, and it's still there causing problems. And then they kind of turn to that thing that was dopaminergic, that is feeding their dopamine because they had a brain injury and no one ever treated it.
Wow. Yeah. And the people that, so the prefrontal cortex, what is that area responsible for?
A lot of stuff. We call it the CEO of the brain.
That's
Decision
your
making,
executive functioning
executive
and
functions, right? So plan,
social
organize,
appropriateness, maybe.
right? So if I don't have that on, I could be disinhibited and just do whatever. Some substances actually turn that off even more. So then the person becomes even more disinhibited, like alcohol. Alcohol affects the prefrontal cortex really quickly. So
Yeah.
that's why they'll start doing, anything, or they're funnier, or
Yes,
you see
I'm
what I mean?
familiar.
And some people who have been hurting, they like having that moment of being the one that gets attention in a positive way, making people laugh. So they might
Oh,
be
yeah.
turning to that substance because in that moment they feel that they matter. They feel that they're funny. They feel
Oh,
that
yeah.
they're, not thinking about the traumas that they had because they forgot about them in that moment. So
Yeah, they're having a
that's what I
good
mean about
time.
sometimes substances could do that to people.
Yeah.
But with the prefrontal cortex, it's our decision making. If I turn that
Decision.
off, what decisions do you think I'm going to make? Not very
That's
good
why they
ones.
call alcohol the truth serum, right?
Uh-huh, exactly.
Yeah. I have a whole theory about that. I don't feel like it's the truth. I just feel like it's like your first impulsive thoughts. It's not
Yeah, yeah.
necessarily what you
It
really
makes you
believe.
impulsive, that prefrontal
Yeah.
cortex. Um,
And the limbic system, what is the limbic system responsible for?
Literally all of our emotions, whether it's anxiety emotions, whether it is mood, right? The thalamus, which is part of the deep limbic, it controls a lot of circadian rhythms. So sleep cycle, appetite cycle, sexual cycle. So like I call it sexual appetite, right? So our libido, it could be
Mhm.
hindered. So if someone's limbic system is overworked, they're more likely to have a distorted cyclical things. So they could have, hungry at the wrong time of the day, sleepy at the wrong time of the day, energized at the wrong time of the day. That it disturbs their everyday function.
Yeah.
So if that's not working well, that person is going to try to do something, take something to make it a little better. Unfortunately, if it's a
Right.
substance, then we get stuck in a cycle of it gets better and then it gets worse and then it gets better and it gets
Yeah.
worse. So then my job at first, like, let's get out of this merry-go-round,
Yeah.
you know, but that's
So
unfortunately what it's.
people who are attracted to sort of like the slowdown or the drive, like I was a big, I was an equal opportunity abuser. I had like an alcohol sandwich. It was like alcohol, drugs, and then some more alcohol. But um, but I really liked the cannabis. So I'm trying to regulate my nervous system, my limbic system, my emotions, and that's about suppression. Is that right?
Yeah,
Oh,
especially
okay.
cannabis.
Yeah.
Cannabis does it a lot stronger than alcohol, for example, but they're
Yeah.
pretty GABAergic.
Gavin.
Most of the time, people who radiate towards those have a
Yeah.
very anxious nervous system. So then my
Yeah.
job is to say, what's causing it anxious? What's worsening the anxiety?
Uh,
We
yeah.
think that anxiety is only in our mind. Like if we have intrusive thoughts or like I can't shut off my brain, that's part
Right.
of it. There's also a lot of physiological things that occur when someone is anxious. That's why sometimes people get sweaty palms, heart rate goes up, shortness of breath, because the brain connects with the heart.
Yeah.
And the heart says, oh crap, something's going on.
Yeah.
Turn
Yeah.
everything on, you know? So then
Okay.
we're going to radiate towards something that is going to calm that whole circuitry down.
Yeah.
I feel somewhat better, at least in that moment, you know?
Yeah. You mentioned GABAergic. I don't even think I'm saying that word right, but I understand that GABA plays a role. Can you describe what GABA is and maybe like where it's created in the body and the effect that it has on our nervous system?
Yeah, GABA is, first of all, is the most abundant neurotransmitter in our nervous system.
Okay, neurotransmitter.
GABA is the only one that calms things down.
Oh.
So, for example, someone with a seizure disorder, that's a very active nervous system. So, how do
Hmm.
we calm it? With medications that increase GABA, anti-epileptics. Now, in psychiatry, we call those mood stabilizers, but it's the same thing, right?
Okay.
There are medications that increase GABA. So if you have epilepsy, we're going to give you something to calm down that overactive nervous system with a GABA thing, right? But in psychiatry, we use mood stabilizers, which I hate that term, but um, it's a GABA thing also, usually the same exact medication, but it's going to calm down your nervous system in a different way. So
Yeah.
GABA, I use it quite a bit. In the last, I don't know, decade, has become very popular as a supplement, which I use it a lot, but mainly because I see a lot of patients with very anxious nervous systems. Um,
I've seen people starting to use that in, like you mentioned, supplements.
mhm.
So you can consume GABA as a supplement. Are there also, you mentioned you don't like the word mood stabilizers.
Stabilizer, yeah.
Yeah. Why don't I
Because
hate that. That's a
first of
very
all,
strong
you
reaction.
know, I think it comes with the diagnosis of bipolar in many people's brains and minds.
Oh,
But unfortunately, even though stigma I think has improved, there's still some diagnoses that have very strong negative views on bipolar being one of them,
yeah.
right? ADHD now has become like the cool diagnosis to have, so everybody must have ADHD. But it's like, well, no, your brain is still not working that well, right? So why do I don't like the name mood stabilizer? Because it sounds like you're not stable, so let's stabilize you, right? So that
Uh,
already kind of has that idea that
oh,
something's wrong with you.
right.
So let's stabilize you. And unfortunately, sometimes people use it in a way that is a little condescending, because I've heard from patients telling me, "Oh, my psychiatrist told me that we need to stabilize you, we need to put you on a mood stabilizer." So then when they sit in front of me, and then now I'm trying to explain to them, well, it's a medication that increases GABA, is also going to help with your anxiety. Their first thing is, "Doctor, I don't have bipolar." I'm like, so?
Oh, that's interesting. I was thinking mood stabilizer as like anxiety, depression, but yeah, yeah, bipolar is a
It's
whole
a whole
nother
other
thing.
thing. Yeah.
Yeah, tell me a little about what bipolar is.
So bipolar comes in an array of levels. Let's call it that.
Okay.
But the main thing is you have periods of high mood.
Mm-hmm.
So high, remember that circadian rhythm that I was telling you about?
Yeah.
Everything is up, right?
Mm-hmm.
Lots of
Like
energy,
manic and
motivation to do anything. That's mania, right? Um,
okay.
People don't last too long in that manic stage. They mainly live in depression. So they're most of their year, they're on the opposite side of that spectrum,
Okay.
right? So they're on the
Yeah.
lows, low
Okay.
energy, low motivation, low mood, low libido. So it's that fluctuation that doesn't get stabilized to be kind of like halfway in the middle,
Yeah.
that is the problem, right? So that's why they'll use the term mood stabilizer to stabilize those two poles.
Okay. So that's kind of the appropriate use
Yeah,
for
it
a
is. I
mood
just hate it because
stable
some people use it like
as a
to, it's
catch-all.
like, aha,
Yeah,
yeah.
yeah, yeah. Yeah. No, it's good. Thank you. It's good to clarify like where it's appropriate and where it's not,
Mhm.
right? So, yeah, there are people who have like depression or whatever, so that they don't necessarily need a mood stabilizer. Is that fair?
Yeah. And it really depends on if they have, let's say, anxiety. They might not have
Mhm.
mania, but they have anxiety. So I might use a mood stabilizer to also bring them back down because they need a very strong GABA support.
Ah,
Does
okay.
that make sense now?
To support the limbic
Yeah,
system and
because it's
yeah,
very too overworked. So then we need to like, let's bring it back down with a GABA thing, GABA
yeah,
medication, usually a
yeah.
mood stabilizer.
Okay. Yeah. No, it makes sense, right? It's like there's all these reasons that people self-medicate with drugs and alcohol because there's chemical imbalance. There's, things that we can do to help regulate all that. So that's important to know. Tell me a little bit. I know that you are very passionate about neuroscience and helping to people with addiction issues, help them understand, you know, the neuroscience of addiction. And you talked actually when we were talking before the interview, you mentioned that you've seen a lot of brain scans and how trauma is a direct, you can actually see trauma on brain scans. Tell me a little bit about that.
Yeah. So the scans that I'm referring to are called the SPEC scans. SPEC scans is basically a blood flow study, and it tells us what part of the brains are overworked, right? So
Okay.
there's certain patterns that light up that can indicate some kind of abuse, whether it's psychological, emotional abuse. So even if the person didn't really report it to me, then it allows me to ask better questions. Because I'm like, wait a minute, but your scan shows that you've maybe have experienced some kind of emotional or psychological abuse. And then I can dive in deeper, as opposed to just the person telling me no. And it
I'm
might have been just a
fine.
trauma block, right? Or they don't want to report it.
Yeah.
But that could be what's underneath the whole thing,
Yeah.
right? So when we see that, it allows me to really change how, you know, what direction I go, even during the evaluation.
Okay.
Because if I see that, I'm not going to spend maybe too much time on the substances. I'm going to spend more time on the trauma. What
Yeah.
caused that? And most of the time, the trauma happened, and a year or two later, they started using substances.
Yeah. Yeah, man, I've just heard story after story about people experiencing trauma, and then you're right, not that much later, they start
Start.
drinking and using. So it's interesting. So if somebody is dissociated from their trauma and they come to you and they're just like relapsing a lot, they're struggling with addiction, and you ask them about their history and trauma isn't something that they bring up right away, like what is a school of thought between like creating safety and allowing the trauma to arise as opposed to like how do you know when to bring it up? Like you look at the brain scans and you see it. Like my concern or my curiosity is around can you bring up the fact that they've experienced trauma too soon?
If it's not done by the right person, you might trigger the individual.
Yeah.
So there's been a few instances where I'll tell the patient, this is a pattern that indicates this or that,
Okay.
and you haven't reported anything to me, without going into detail. That's immediately my first thing I say.
Oh,
Would you say that this is accurate with you? Just yes or no.
okay.
Most of the time, they're like yes, and then they break down crying. I'm like,
Oh,
okay, let's stop right there. We're not going to keep going. We got to work with a very trauma focused therapist, very sensitive to how to go in that direction. And then we
yeah.
got to do that, those types of trauma therapies. We can't just jump into the deep end of the pool. But
Right.
most of the time, when I do present it to the patients, I have to in the first evaluation, but
Yeah.
I don't go into too much detail. Um, there's been a few cases where the patients just stay there like, no, and I'm like, okay, don't think about it. I don't want you to try to bring it back into your memory. When we do that, we'll do that in session.
Okay.
We're not going to try to do that and now sit here and try to remember what happened and when and where. Um, Most of those cases, they will tell me there's a period there from maybe the ages of 4 to 9 that I don't remember anything. Chances are it happened during that time.
Yeah. I've heard that
Mm-hmm.
blank spaces in memory, especially in childhood, is a sign of childhood trauma.
Mm-hmm.
Yeah. So I'm curious, how do you handle a situation where somebody has like a revelation during a session? How do we allow somebody a little bit of time and space to start addressing it? But it's like, the hour's up. Maybe you go an hour and how I don't know. I don't know how that goes, but usually that's a timed session. What do you do in a case where someone starts to get triggered and they start talking about it? Like, how do you sort of like patch them up so they can go back out into the
Yeah.
world?
Well, if I feel and like I told you, like I would tell them, we're not going to go into detail. That's not the purpose of today's meeting. Because
Yeah.
usually I'll tell them in the first meeting, in the evaluation, we're going over their scans, right? So then I'll report. I kind of present it like that. Could this
Okay.
be
Yeah,
accurate
that's
to
in the
you? Yes or
beginning.
no, right? But then
Yeah.
let's say they start, oh yeah, I remember now. Blah, blah, blah. I tell them, listen, do you feel that this is something you want to share right now? Most of them say yes. So I let
Okay.
them, because I
Okay.
don't also want them to feel that the person is not, not heard and not supported, because that might be the
Yeah.
first time they're sharing with anybody.
Right.
And most of the times it is. They're like, I've never told this to anyone, but you're right. When I was in sixth grade, this and this and this happened.
Hmm.
So most of the time during the session, I do that at the very beginning. So then I have the rest of the session to go through anything that I need to do to either, de-escalate, help them feel better
Hmm.
before I let them out. Otherwise,
Yeah.
I won't let them out, and I'll
Yeah.
keep going. I'll keep talking with them. But I always tell them this is best to be, that Pandora's box is better to be opened when we're
Yeah.
in doing a cognitive behavioral session or we're doing
Right.
some EMDR or IFS. There is when we open that Pandora's box. But let's say they want to in that moment, I'm not going to stop them because they
Right.
need to let it out. They need
Yeah.
to tell someone because they've never told anybody before.
Yeah, I'm thinking more of like subsequent sessions, like you establish protocols and boundaries in the first few sessions, and sometimes like you know, client or patient starts to kind of go into it like they're ready and they go into it. And yeah, it's I would imagine it's kind of difficult to sort of get them to a place of, I mean, it's hard to siphon that kind of trauma out a little bit at a time. So do you give people like what kind of like practices or skills do you get? Let's say during a session, someone starts to really process, like they can talk about it, they need you to hear it. And at the end of the session, what do you leave them with? Is it like thoughts or ideas or
No,
practices?
I,
How do
I'll I'll walk them through. Let's review what you just shared with me today. So I kind of start with that.
recapping?
If it's something that maybe should have been reported to the police or something, I have to assess if they did, or
Okay.
even if they want to. Now, if it's a minor or something like that, then that's a different story. But let's
Right.
say for assumption right now, it's an adult, not a minor. I ask them, who else have you share this with? And that's when we go to the peer support. Who do you have near
Mm,
you? Doesn't have
yeah.
to be a family member
Right.
that you feel you can go to this person when you want to continue to share more because more things pop into your mind,
Yeah.
right? But for sure, one of the first things is we need to write down everything that comes into your mind.
Mm.
The smallest thing that you're like, I don't know why this keeps popping into my mind, write it down because then we're going to
Um,
unravel, like we're going to go through them even more within the EMDR sessions. Now, I don't do EMDR because it's very emotionally heavy for
it
me to
is.
already see them as a psychiatrist and then also do EMDR sessions with them. So it's more of a protective thing for me to not do it. So then I
Okay.
always refer them to someone on my team that they're very good at that. And then I
Can
meet
you
with them
talk a
on a
little bit
regular basis.
about, sorry to interrupt you. Could you
No, you're
talk a
good.
little bit about what EMDR, I know it's eye movement desensitization reprocessing,
Mhm.
but can you speak to a little bit about like why, like I know I've done it myself. It's actually hugely helpful. I've interviewed a ton of people who really benefit from it. What is it about EMDR that helps somebody to find peace with their trauma?
First of all, it's an exposure type of therapy,
Mm,
right? We're slowly re-exposing ourselves to those events, but in a different angle, right?
okay.
When we're guided by someone, that person, if they're very sensitive to your body and how you're responding to stressors, we can pick up immediately and say, let's turn back again. So I tell my patients, it's like going down a dark alley. And none of us want to go down dark alleys because they're scary, especially when we know we're going to see what we're going to see there, right? But the EMDR session, we're going to go down that dark alley with someone that is an expert, someone that's going to take us down that path and tell us, okay, let's stop here. We can't keep going. Next time we meet, we'll keep going even further. Right. So it's an exposure therapy because little by little, I'm exposing my mind to maybe something that I had in my subconscious that I kind of blocked.
Yeah.
And then they can draw you back out. So most of the people that I work with know what to do in case of a a trigger that might have happened during the session. There's certain things that certain supplements or medications that I prescribe to my patients to have just in case if
Yeah.
that were to happen, like a really bad one. And then I also educate my therapist that I work with on, listen, he or she has been prescribed this. If you notice that this is going really bad, tell them to take it. Not everything is good because some medications can actually block the person and numb them, and you don't want to do that,
Right.
right? You want to
Yeah.
go into that memory, right? You want to go back into
Right.
that thing. And then the reprocessing is literally reprocess how my body, how my mind reacts to this image, right?
Mm,
That's why the eye movement, it's a visualization type of therapy because we're visualizing again what was done to me. But I now need to
yeah.
change my body response to that memory.
Right.
It's like I tell my patients, it's like when you smell cookies and you immediately think of like your grandma or your mom and this beautiful memory that you had one day when they made your cookies. It's the same exact thing, right?
Right.
I don't want you to later smell that cookie and be freaking out because something happened to you during that moment. But I want you to always be able to smell cookies moving forward. So that's where that reprocessing, what it's supposed to do is change how you respond to whatever the trigger was, a smell, a visual, usually it's a visual,
Yeah.
an idea of a person, a situation. So you don't
Memory.
have that fight, flight, or flee response every single time.
That is so important. I mean, I feel like a lot of mental health spaces support peer support, like support groups, whatever. There's a lot of talk about not triggering people, like being sensitive to certain language and stuff. And I don't know that I actually agree with that. I would prefer that we actually help people get into a situation with a professional where they can reprocess these emotional experiences so they are not triggered rather than try to bubble wrap people through life.
Right.
Like it's not a reasonable
I agree with
expectation.
you. I think that's happening a lot today in the mental health care space. It's
Yeah.
more of like we don't want anyone to feel anything. Don't remind them of anything. Don't, and yeah, that's I love that visual, right? Bubble wrapping people. Um,
Yeah.
that's not therapeutic.
It's not.
That's keeping that wound in there rotting,
Right.
and we
Yeah.
have to remove the band-aid. Removing the band-aid is going to hurt, but it's going to feel so much
Yeah.
better when it's actually healed.
Yeah.
If I just leave that wound in there rotting, you're going to be in pain forever.
Right.
So no, we
Yeah.
have to remove it. But
Yeah.
that's where
There's
that
that saying you have to
professional
feel it to heal it, right?
you
And that's
do,
yeah.
unfortunately. But that's
Yeah.
the
With
way
support.
that needs yeah, obviously with professionals, but that's where the professional support comes in.
Yeah.
And someone who really can guide the person into let's remove that band-aid slowly, right?
Yeah.
As opposed to just going there and like
Yeah.
that's not a good idea.
That's
Right?
overwhelming. Yeah. When
Right.
people get triggered, they can be super overwhelmed. That's what makes people want to use is when they feel triggered,
Mhm.
when they have an emotion that they cannot tolerate for one reason or another. I feel like that's what the term triggered sort of refers to is that we have an emotion that is super overwhelming. And when we can't handle them, then we medicate them ourselves, which can be super destructive. But I really like this idea of like what EMDR does is reprocessing the triggers so that you're free of it.
Mhm. And then you don't keep going to that same way of trying to cope with it
Yeah.
because at some point you started that with the substance and now your mind now made a connection with I feel this, I'm going to do this.
Yeah.
I don't feel good, I'm going to go do drink. Or
Yeah.
I feel a certain way, I don't like this feeling, I'm going to go do
Yeah.
this over here. Sometimes we have to sit in that feeling
Yeah.
and it feels very uncomfortable. Nobody likes pain,
Mhm.
obviously, right? But there's a lot to say about being in pain, not severe pain, but being in a place where I feel uncomfortable. Okay, let's be
Yeah.
here
There's
a
like
little
growing
longer.
pains.
Right. Let's be here a little longer.
Yeah.
And then you reprocess that pain. So every time you look at that person, you're not going to get triggered
Mm.
because I've already experienced that pain. And you know what? After a few minutes, it goes away because that's just a trauma response.
It is. It's
And
a trauma
eventually it
response.
will go away.
Yeah. I feel like we
Just
have to learn that we can survive our feelings, right?
we're a lot
Like,
stronger than we think we are.
yeah.
And unfortunately, and I say unfortunately because I think that's one of the biggest issues we have right now with just mental health providers. We're trying to do a lot of this, like it's going to be okay,
A lot of
it's going
soothing.
to be okay, and not really telling people you need to do this, and it's
Yeah.
going to feel very uncomfortable. But trust me, at the end of it, you're going to be more resilient, which is one of the
Yeah.
things that I always preach. I can't just leave you there. If I leave you
Right.
there and I know where you could be, that's bad medicine.
Right. Yeah.
I know where you could be.
Yeah, it kind of reminds me of exercise in a way. Like we actually need to put ourselves through some stress, and that's what makes us
Hmm.
stronger.
Right.
And I think the total avoidance of emotional stress is sort of like whatever the opposite of resilience is. It sounds like the EMDR and different kinds of therapy actually helps you to create resilience. Is that fair?
That is very fair to say.
Yeah.
And I'm a big believer of that. And I love that idea of exercise because the same thing happens. Like I'm working out with my trainer and we're doing what is he calls it progressive overload, which you add 3 pounds. And then
Yeah.
next week you add another 3 pounds. And now I go back to my chart. I'm like, man, I've lifted a lot more than I did from 3 months ago. But then what does
Yeah.
that do? Immediately I feel good.
Yeah.
Then I can see where I have been and where I was. So someone with trauma, then they can go back and be like, wow, that's not happening anymore.
Yeah.
I'm healing
Healing.
as opposed to
Yeah.
just staying there in the pain.
Yeah, no, that's really good. I was chatting with this gal who just started Pilates, and she's like, "Oh my God, is this ever going to get easier?" And I was like, "No, but you're going to get stronger,"
Exactly.
which is kind of the point. So I could see how, when people are able to get support, like encouragement to actually talk about the trauma, to feel it, to heal it, to reprocess it, that's what makes somebody stronger because they're not carrying around that wound that triggers the
And they're not being defined by it.
oh yeah,
You're not your trauma.
right,
That's something that was done to you. You didn't
right,
cause it. It has nothing to do with what you did or didn't do or who you are.
right,
It happened to you.
yeah,
Is it something that I would have never wanted to happen? Of course,
yeah.
but it did. So I always tell patients, now what?
Now what?
We got to move forward. We gotta
Yeah,
we gotta start at least start the healing process. And if I keep that wound in there covered up with a nasty band-aid, you're
yeah,
just not going to heal. You
yeah. You're
know,
gonna be vulnerable.
you're going to be
A lot of
vulnerable every single time.
A lot of what you're talking about sounds like reinventing identity, right? You talked about when you first meet with somebody, you ask who are you, which is really a profound question because I think people tend to answer that with what they do or what they've
Mhm.
done, or
Yeah.
like we don't typically respond with like character attributes.
Right.
And so, and I do love this idea that you mentioned that if someone that's carrying trauma, it's like that's not who you are. So, tell me a little bit about how you help people sort of reshape their identity to be sort of like this sober person or this healthy person, this healed person. What does that look like?
Well, I actually work on those attributes. So
Like,
one
what
of
do
the
you want to
things,
be?
who are you? What do you want to be? What are
Yeah.
your goals in life? And not jobs.
Right, right, right.
Not jobs. So one of the things that I started doing this year is I started publishing a wellness magazine. And every single issue is a certain attribute. And I think a lot of these things we don't talk about them anymore. I think we talk more about the pathologies. I have anxiety, I have
Yes.
this, insomnia, whatever. But we don't talk about I have integrity,
Right.
or we talk about resilience. We're not having these conversations. And I think these are conversations that we need to be having. And I say we, I'm talking about the mental health care space, you
Okay.
know? So that's one of the resources that I started working on. And another one is something that I call the Power Up series. So every month there is one of those, um, you know, traits or things that I want my patients
Attributes
to
or,
work on. Right. So one of
yeah.
the first ones is confidence. I notice that a lot of people who have experienced trauma have very low confidence. I'm never going to get better. This is never going to go away. I've done this and I have failed. So confidence is going down, down, and down. So what did I do? Let's put together a workbook that at least we can start talking about what is confidence. Who is a confident person? How do we build resilience? What part of our brain helps us restructure and rebuild that of who I am? Because I'm a firm believer that part of the healing for someone with trauma, and that includes substances, like I told you, if there's substances, there's trauma, um, is separating the person from the event, separating the person from that, even that substance. You are not your substance. That's not who you are. So we've established that. So being able to separate the person from those events is where the healing really starts happening,
Yeah.
because then I'm not defined by that. And yes, that's something that happened to me, but I can see it today and I'm not going to get triggered because I worked on it and I'm someone
Yeah.
with resilience, with integrity, with confidence. So, so no matter what is thrown at me in the future, I can face it because I
Yeah.
was able to face this thing. And sometimes, I tell people that and I'm like, sound a little bit like cliche and corny, but it's true. I think
It
these are
is.
real life, tangible things that we have to be, in my opinion, be educating people on and how they can sharpen those tools to be those kinds of people. Because guess what? Life is full of stressors and life is full of events, and God knows in the future we might have another one. I want you to have that resilience and not be bubble wrapped, which I love that visual. I'm going to use
Yeah.
it. um,
Yeah.
be bubble wrapped for everything,
Yeah.
because no, that's not the real world that we live in. Things happen all the time and we see them all the time. We
Yeah.
have this little device in our hand that we can see trauma all the time,
It's too
anywhere,
much.
which is too much. And
Yeah.
I think that's another thing that's happening. But it's being able to start going into that direction, that all these other things, the substance, the eating disorder, the sexual
Yeah.
addiction, start coming off a little bit.
Yeah.
Because then, you know what? I have this confidence.
Yeah, no, I love this idea of cultivating attributes because a lot of times what you hear is people saying, well, this is just who I am. Like I'm an introvert, I have ADHD, we pathologize. There's a lot of pathologizing ourselves, and that
Yeah.
becomes like an excuse
Right.
as to why our lives are the way they are. But really, these ideas about having confidence, charisma, being resilient, these are things that we can actually cultivate. It's not necessarily part of our identity. Like we get to pick and choose,
Mm-hmm.
be intentional about our identity.
Correct. And these are all things that you can actually work on.
Yeah.
But my other questions I was asking at the beginning is that, do you want to? Do
Yeah.
you want to be someone who is confident? Do you imagine yourself confident? I said that
Yeah.
to that one patient that inspired me to start this whole power up series thing.
Yeah.
And it was confidence, lacking so much confidence. And today, I always go back, right? Let's look at the whole year, the last 2 years that we've been working together. Isn't it great where you're at now? We'll call
Yeah.
him Paul. His name is not Paul. But I'm like, Paul, 2 years ago, couldn't do that. And
Right.
look at all the things you're doing now.
Yeah.
Isn't that amazing?
Yeah.
So
Some
that's how you can
acknowledgement.
also look back and say, oh, crap, yeah. And now he's telling me all these things that he wants to do. Um, and just the way he's expressing himself, I'm like, Paul, man, you sound confident.
Yeah.
This is great. I want you to keep working on that.
Yeah.
So he's no longer the angry person that lost every job that he was at because of his anger and his
Mhm.
internal hate for people. Because that was literally what he would say. He's like, I just hate people. Right.
Yeah.
He no longer has that. But
That's
I
amazing.
took away that focus on that and more on like, okay, well then who do you want to be?
Right.
You
Yeah. When I'm working with people,
attributes.
sometimes I say, what would a confident woman do in this situation? What a woman with self-respect, what would she say in this situation? Like if you weren't that person, what if you were the strong person, what would they do in this
Mhm.
situation? And that's sort of like that's the question that you should be asking yourself in all your situations. What would she
And
do?
that includes to resilience.
Yeah.
you know if tomorrow you're facing this problem today because you're being triggered because it's somewhat related to your trauma, um how can we improve that response, that trauma
Yeah.
response that you're having, so we
Yeah.
can build on that resilience, so then you gain confidence, then you get these feelings of integrity, and
Yeah.
things like that.
Yeah, I
um
think that starts to reshape your actual identity.
mhm.
Yeah. I love that. You mentioned having some resources. So like the work, did you say there was a workbook that you offer
Yeah.
or where
Yeah, it's
does
called the Power Up series. It's all on my website. It's free. Every
okay.
month I put a new one, but all the older ones are in there too. I call it Power Up Your Brain. So it's like looking at how these attributes, you can actually cultivate them and sharpen them and improve them.
Love
But
that.
then looking at the different brain regions that play a role into that,
Mhm.
and how it looks like when you don't have that, then what are some of the practical things that you can do to enhance it, so then that part of the brain works better, you're going to work better. And then our magazine has a lot to do with those same themes. And our magazine just has more in-depth articles and stories. I have a feature that I've been doing every other month, which is letters to myself. So I ask
Ooh.
some of my clients to write a letter to their future self or their past self. And it's good to see that because that also adds to the reader, hey, I'm not alone on this.
Yeah.
You know, I see there's a lot of people, and we think, with social media, that people are turning to support in that way. I don't think they are. I think there's more of a comparison, that they're not turning for these groups for support. Could be
Yeah.
wrong, right? I could be very wrong. But from my clinical experience, I don't see people going to social media and these kind of connect groups on Facebook and stuff to actually look for support. I don't think they are.
Yeah.
They're seeing, oh, look, so and so is better than me. So and so now is no longer on substances, and I'm still here, right? So it's
Right.
this comparison game that is happening that is actually keeping people from connecting.
Yeah. Yeah. Social media is very far from being social.
Yeah,
So
yeah. It's
yeah,
not.
it's not great. I'm not it's so funny. I'm not a huge fan. Sometimes I'll post on it, but I don't actually participate in it a whole lot. It's so interesting because it's like I can almost hear the people going, yeah, but I love social media. I get all these inspirational quotes that some people uplift and inspire. But I would argue that it's almost like drugs. You get a little bit of bump and you get a little bit of dopamine from those
Yeah,
little positive messages, but you don't, but then you scroll and then you see tons of garbage.
yeah.
And for
That's
me,
why I got on social media.
yeah,
There's so much garbage.
so much garbage.
And I know a lot of my colleagues that they would tell me like, man, you're so active and stuff. I'm like, yeah, but it was because I was inspired by where I was working, that they said, we're the professionals. We should be the ones giving that information out there.
Yeah,
There's so much wrong information, like just
right.
wrong
Yeah,
information,
yeah,
that is misleading people,
yeah.
in a way that it's keeping them in that bubble wrap, or keeping
Hmm.
them in still in the substance, and not
Yeah,
really telling people the truth, because then we don't want to be, not get likes, right? Because I'm actually telling people what is really
yeah,
happening to their brain.
right.
But what inspired me was that I was like, okay, I need to educate, because there's so much garbage.
Yeah.
But for a long time, I was like, I am not going to be that person.
I
I'm gonna
know.
add more
I know. It's
noise.
it's a
You
double-edged
know,
sword because you want to educate and
I
support and
know, I
inspire.
know.
But so I actually found a little workaround for that. I have found that there are tools that you can use so that you can post to social media, but you're not on social media.
Yeah, correct.
You can respond to comments like
Hmm.
outside of social media so that you don't
You
because
don't get
you
stuck
like
in the yeah.
yeah, like I will go on social media with good intentions to post something positive or to educate or whatever, but then I expose myself to all this garbage and then I feel like garbage. It's like, what am I even doing here?
Yeah. No, I really tell myself like, okay, today is social media day. I'm gonna film my reels. I'm gonna do everything today,
Yeah.
and then I program and I post them, and then bye. Because
Yeah.
yeah, you can get stuck in that doom scrolling very
Yeah,
easily.
very,
You
I am just not responsible enough to, to scroll social media. Yeah, post and dip is kind of my
Yeah.
my reframe. Well, listen, Dr. Hector, it was so nice to be able to spend some time with you. I know you got to run. So I'm going to leave links to all your things
Yeah.
in the show notes, but for somebody who's just driving, what's the best place to find your content?
Well, I have two websites. One is drhector.com, which
Okay,
is
that's easy to
that's
remember.
yeah, and
Is
you spell
doctor
out the word
spelled
doctor.
out or
Yeah, you have to spell out the word doctor.
okay.
Um, and the other one is the whitebutterflyclinic.com, which is the name of my practice.
Okay.
And everything is on there. A
Okay.
lot of the resources are free. Our magazine obviously is free. And so is the Power Up series, which is something that I started to do because I saw there's a lot of garbage,
Love it.
and lots of people that are kind of, they don't know when to start. They don't know, how to start. I'm like,
Yeah.
okay, let's start with these simple daily questions and exercises to get the ball rolling. That's why I started the Power
Awesome.
Up series.
Love it. Power Up series. And what's your handle on Instagram?
Doctor_Hector. And you same thing, spell out the word doctor.
Yay. Okay. I'm going to leave links to all this in the show notes, but it was such a pleasure to get to spend some time
Thank
with you
you. Thank
today.
you. Thank
Thank you
you.
so much for educating and all the work that you do. I really appreciate it.
Thank you so much for having me.